A good day to Dr. Sana Anwar Lashari. This is our group assignment presentation, which is the personality disorder Schizotypal STPD by group 4. These are our group members. My name is FANG. My metric number is 287579. Now I will start about the introduction. Schizotypal personality disorder (STPD) is a mental health condition marked by a consistent pattern of intensive discomfort with close relationship and social interaction. Suspicion, variety views, and struggle behavior are all the characteristics of STPD patients. What are the signs and symptoms of the schizotypal personality disorder? A person with the schizotypal personality disorder may have intense social anxiety and poor social relationships, not have close friends or confidence except for first-degree relatives, have peculiar behavior and mannerism, have odd talk and speech, such as using excessively abstract and concrete perhaps or using perhaps or words in unusual ways, have unusual perceptive experience and magical beliefs such as thinking they have special paranormal powers, incorrectly interpret ordinary situations or happening as having special meaning for them, be paranoid and suspicious of other intentions, have difficulty with responding appropriately to social cues such as maintaining eye contact, have a lack motivation and underachieve in educational and work setting. So, what causes schizotypal personality disorder? Actually, personality disorder including schizotypal personality disorder are among the least understood mental health conditions. Researchers are still trying to figure out the exact cause of them, but believe they develop due to several factors. Researchers think the cause of schizotypal personality disorder is mainly biological and genetic because it shares many of the brain strength characteristics of schizophrenia. STPD is also more common among biological relatives of people with schizophrenia or cluster A personality disorder, which suggests a genetic link.
Next one is 2.0, which is critical analysis, which before that, let me introduce myself. My name is IKMAL bin FAZIR, metric number 2X7031. The first is comparison and differences between schizotypal personality disorder, which we know as STPD, with antisocial personality disorder, as we can know as SASPD. There's a lot of differences among these two personality disorder, which is we have 5 aspects. The first one is core element, social interaction, perceptual and cognitive disturbance, expression of emotion, and also treatment approaches. But in the slide, I just put 3 elements of it only. Okay, the first one that I put is core element, which is STPD is distinguished by odd behavior, social and interpersonal deficiencies, and odd thought process. Social anxiety is a common symptom of STPD, but for ASPD, disregard for others' right, lack of empathy, and a propensity to transgress social standard are the characteristic of ASPD. But for the social interaction between these two have a certain differences, which the STPD person include social anxiety and a hard time establishing a strong relationship. But for ASPD, the social interaction of people with ASPD have frequently been troublesome in the past, and they frequently struggle to keep partnership the last over time. And also, the last but not least, we can see among expression of emotion for STPD person that they may struggle to communicate their feeling in the right way or may exhibit inappropriate emotional reaction. But for ASPD, many of them exhibit a superficial affect and lack of emotional sensitivity. They frequently exhibit emotional detachment or indifferences towards the sentiments of others around them and may struggle to understand or recognize others people's emotions. That's all for me. Thank you.
My name is Wong. Mention number 2 SMSS12 and will present about the correlation and differences between the multiple personality disorder and dissociative identity disorder. First, for the STPD, is defined as the consistent pattern of extreme discomfort with relationship and social situation. Mostly of them become loner by social anxiety and they often perform unusual habit, behavior, or thinking and speech pattern, and suffering hard time to keep eye contact and respond to the social due to their lack of motivation in the life. Next is DID. DID is a mental concept or a loose of connection between a person to feeling, action, memory, and a sense of identify. Most sufferers have at least 2 or 6 several personality because of the number of factors including trauma that the disorder individual have experienced. Furthermore, they also have confusion of identity, memory problem related to the important event because of they are unable to recall the specific information. In addition, activity side is when they are child or adolescent. Most of them they don't diagnose this disorder until they turn to adult. The factors that may cause to develop this disorder, for example, including mental illness in their family, psychopathic brain damage, and still are experienced in their childhood, injury when before the birth, or the abnormality of their brain structure. For DID side, is they like suddenly change their mood and forgot all things they currently do. The factors that may cause to develop DID, for example, including long-term physical, sexual, emotional abuse, or they live in a stressful or unstable home. There are also other factors that may cause DID, for example, natural disaster and their earlier time medical risk complication for psychotypal personality disorder, including anxiety, depression, the use of alcohol or drugs, have the highest risks of development other personality disorder and relationship problem. Meanwhile, for the DID, dissociative identity disorder, including the risk of post-traumatic stress disorder, alcoholism, sleep insomnia, or the eating disorder. Meanwhile, there are cases by famous persons like Kim Jong-un. He is a former leader of North Korea who now have less of interest in socializing because he thinks people is a trick of his leadership. Meanwhile, DID sufferer Shelby Dawson, she is an American art teacher who now has 16 teaching personality with its unique variety of behavior, memory, and characteristic. In conclusion, these are some of the details to contrast bone disorder. The patient must get the better therapy of treatment, such as genetic treatment, supportive therapy of antidepressants to help them reduce their certain symptoms. For people, they can help them, encourage them, don't judge and lead them to the personal well-being. That's all from me. Thank you.
Good day, doctor and all my friends. My name is Liu Chuling. My matrix number is 287786. Now, I will relate an appropriate personality theory in discussing schizotypal personality disorder (STPD). One theory of personality that can be related when discussing STPD is the 5-factor model (FFM), also known as the Big Five personality trait. The 5-factor model is a well-known and research framework for defining personality in 5 major dimensions, which is openness to new experience, conscientiousness, extroversion, agreeableness, and neuroticism. People with STPD frequently demonstrate characteristics related to openness to experience, but in a distinct and unconventional manner. They may have strength of unconventional belief, engage in magical thinking, and have unusual perceptual experience. They may have lower level of conscientiousness because they frequently struggle with organizing their thoughts, sticking to organized routine, and complying with societal norms or expectations. Next, low level of extroversion are associated as well with schizotypal personality disorder. People with STPD are introverted, socially isolated, and feel uncomfortable in social situations. They also exhibit reduced level of agreeableness due to interpersonal and social concerns, suspiciousness, and paranoid beliefs, which can make it difficult to develop trusting and cooperative relationships. Finally, patients with STPD have significantly greater neuroticism level. People with STPD frequently suffer anxiety and may struggle to regulate their emotions. Their emotional expressions may be restricted, and they may exhibit inappropriate or unusual emotional response.
A very good day to everyone. My name is Lim Ensin and my treatment number is 287409. Today, I'll be talking about the treatment for schizotypal STPD. STPD is a cluster A personality disorder characterized by peculiar behavior, unconventional beliefs, and challenges in social interactions. So, comprehensive treatment approach for STPD includes the psychotherapy, medication in some cases, and support from a multidisciplinary treatment team. First of all, psychotherapy, particularly the cognitive behavioral therapy CBT, is the primary treatment modality for STPD. CBT focuses on challenging distorted thinking patterns, reducing social anxiety, and improving social skills. Next, group therapy and social skills training are effective in enhancing the social functioning and reducing social isolation. In some cases, medications such as low dose of antipsychotics may be considered to manage specific symptoms associated with STPD. Apart from therapy-based treatment, case management and community support program also ensures the comprehensive treatment planning and resource access. Although STPD is a lifelong condition, some symptoms may be improved over time through experiences that foster positive traits such as self-confidence, a belief in one's ability to overcome difficulties, and a sense of social support. So, factors that appear to help reduce the symptoms of STPD includes positive relationships, healthy routines, consistent medication use, and a sense of achievement. Personalized treatment and ongoing research are crucial for addressing the unique needs and challenges of individuals with STPD effectively. With the right support and interventions, individuals with STPD can improve their social functioning and lead fulfilling lives.
Hi, my name is Lashari BINTI and my metric number is 288791. So I will be continuing with the prevention for schizotypal. The schizotypal personality disorder is usually incurable. However, some of the following actions may lessen and prevent the disorder even more. Firstly, early detection and intervention. So managing the symptom of STPD can be greatly improved by early discovery and action. It's critical to seek professional assistance as soon as possible if someone exhibits STPD symptoms or develop persistent issues with social interaction, strange belief, or visual abnormalities. Individual can benefit from early intervention by receiving the right care and support. So secondly, creating an atmosphere that is supportive and nurturing, especially during childhood and adolescence, may improve overall mental health and may lower the risk of developing personality disorders. This entails offering emotional support and so on. Right. Thirdly, awareness and education on mental health are important because they can assist to lessen the stigma, encourage early detection, and motivate people to seek help. Individuals and the people in their support networks can be empowered by information about mental health and the tools that are available to seek out the right interventions. And fourthly, stress management and healthy coping strategies. Promoting the growth of stress reduction and healthy coping strategies can help with STPD symptom management. This might entail imparting knowledge on effective problem-solving procedures, encouraging self-care habits, and teaching relaxation techniques. So while all these approaches may not prevent the development of STPD outright, they can at least contribute to overall mental well-being and potentially help individuals manage the symptom more effectively.